Results from adequately powered, well-designed, and well-conducted clinical trials are needed to provide more specific evidence-based guidance on the role of ivermectin in the treatment of COVID-19. However, the NIH has said that for other things, quote, ivermectin has been widely used and is generally well tolerated. God. Well, it's a bad day when a talk show host knows more about how to treat COVID than most doctors and the NIH. I claim that I am such a person. And it is with no pride that I say it. It is with embarrassment for my country and shame for the medical profession. Slovakia becomes the first EU nation to formally approve ivermectin for both prophylaxis and treatment COVID-19 patients. The Slovakia Republic's Minister of Health has formally registered ivermectin as an approved prophylaxis and treatment for SARS-CoV-2, the virus behind COVID-19. In breaking news, the authorization occurred yesterday. That's a couple of weeks ago, as doctors received the news that they could proceed with formally authorized prescriptions both in hospitals and outpatients. The mortality rate in nursing homes in Germany is about 25% to 30%. After treating about 100 residents with ivermectin, the rate in one case series apparently went down to, what do you think the number is? No. From 25 to 30% to 5%. So all of you who have supported the doctors and Fauci and the others not recommending ivermectin, you have participated in death. But you're a nice person, so you live with yourself. And that's fine. I don't want you not to be able to live with yourself. I want you to do penitence. God, it's disgusting. The number of lives shattered because of death and because of livelihoods ruined because we wouldn't use ivermectin and hydroxychloroquine and zinc. There's not been, in modern times, there's not been as irresponsible a choice made by authorities as that. There is nothing comparable in the medical world. How about this one? You hear about all these people saying, oh, well, if you get the vaccination, you could still transmit the virus. There's a new one. Jerusalem Post. Coronavirus. Can a vaccinated person still spread COVID? Several Israeli research teams are getting very promising results that the answer is no. This is from 2 days ago. After nearly 2 months, Israeli data is beginning to confirm what Pfizer already knew. Their coronavirus vaccine stopped symptomatic and severe COVID-19. There is growing evidence that people who get vaccinated do not spread the virus very much, if at all. So I have a question. Why is Fauci telling people to wear masks even after vaccination? Abundance of caution, AOC. That's what it stands for, AOC. Abundance of caution. Earlier this week, a SARS-CoV-2 immunity and reinfection evaluation report by Public Health England was pre-printed online by the peer-reviewed Lancet Medical Journal that evaluated staff working in publicly funded hospitals in the UK. The study measured the impact of a single dose of the Pfizer vaccine over an 8-week period and found, quote, strong evidence that vaccinating working-age adults will substantially reduce asymptomatic, and symptomatic SARS-CoV-2 infection, and therefore reduce transmission of infection in the population. Wearing a mask. I got a question for you folks. How's this? If the vaccine is effective, and it apparently is, why do you care if other people wear masks? Somebody's got to explain that to me. Yeah, I got the vaccination, but you better wear a mask. Or even more bizarre, I'll wear a mask. That's why this nonsense of it will need passports in order to travel. If you're worried about contracting the illness, get vaccinated, and that ends the issue. What do you care if I'm vaccinated or not? We're going to still have to sit in airplanes and breathe in our own carbon dioxide for 5 hours? I can't tell you, I've traveled 130 countries, every single state, basically every week for much of my life. And I not only have no problem with travel, it is a joy. But I rue going to Wisconsin this week, sitting on a plane and wearing a mask, knowing what a fraud I'm participating in. Total fraud. Because while you eat, you don't have to do it, as it should be. But the ultimate fraud is, if you got a vaccine, why do you care if I wear a mask? That will be very interesting to hear an answer to.